So, welcome everybody to WOTBaby Conversations, and I'm very excited to be talking to Zoe Yance today. And Zoe is a physiotherapist at Function PCP in Putney, which is right here in Sydney. And she's been a physio for 5 years now. Am I right? Yeah.
Yes, that's right. Yep.
Yes. And Zoe has a special interest in women's health. So, women's health right back from puberty, prenatal, postnatal, into menopause, which I'm very interested in because that's where I'm at. So
The whole journey.
the whole journey. So I am really happy to be speaking to you today, Zoe, because this is just an area of women's health that I think is not talked about, and I don't think that there is near enough information out there. And I find, well, through my own personal journey, I know that I very much, I did have issues. Whilst I was pregnant, and I had a very tough labour and birth with my first child, and ended up having a 4th-degree tear, which we won't go into that, but it was pretty horrific. And
Yep.
I then went on to pretty much, I'd say, suffer through that first, little while with him as a baby. And then, moving forward, because I was being my first baby, I was so invested in just taking care of him. And that was all I thought about. So I kind of put myself very much last, and am still regretting that I did that. So I also obviously work with so many mums, new mums, and I find that some of them talk to me about the issues that they have, and a lot of them talk to me about their pregnancy and what they went through, but it's not talked about. And I think if mums aren't well themselves, then how can they take care of their baby? So I'm really, really excited to be talking to you today, and I'm sure that lots of mums are going to listen to this and they're going to get something out of it, and I hope that they do go and find the help that they need. So so welcome, and thank you for being here.
Thanks so much for having me, Jen.
Yeah, my pleasure. So just first of all, tell us a little bit about yourself, your training, and how you came, because obviously physiotherapy, there's a wide range of things that you could be doing. So how did the interest grow in this area?
Yeah, so I finished school and I knew I wanted to be a physio straight away. So I went straight into my university degree at Sydney Uni, a Bachelor of Physiotherapy. Got that over and done with in 4 years, and then started working in a private practice. And as I started to see patients come through, particularly women, I felt like there was something there that I was missing all the time, because in all honesty, our training at uni doesn't cover much of women's health. And as I started to see these women and I felt like there was something there that I couldn't quite help them with, that's when I started to delve a little bit into women's health. And the Australian Physiotherapy Association offers a really nice women's health stream, they call it now, where physios can start to delve into this area and learn, because physio on its own is such a large area, and then women's health on its own is also such a large area as we deal with all the life stages. And then my sister had a baby, and then my sister-in-law had a baby, and I saw them start to come through it and some of the issues that they were dealing with. And I thought to myself that this was really an area that I wanted to help in, because you're exactly right. Mums, first-time mums particularly, they have this baby, everything is about the baby and they forget about themselves. And then I see them 3 or 4 babies down the line and they say, oh my gosh, I wish I knew this when I first had my baby, but they've left it 3 or 4 babies later when they've had time to catch up. You know what I mean?
Yeah, that's right.
Yeah.
And I don't think that, because I know I'm speaking from my past experience myself, sometimes a lot of women don't know that there's actually a problem.
Yes.
Until it's way too late. They don't realise that there's something that they can be doing.
Yeah.
Or that it's a problem. I think maybe you think, well, I've had a baby, I've been through, giving birth. Perhaps this is just the way that my body's supposed to be responding.
That's right. And women go, oh, I leak urine sometimes, but don't all mums leak urine? Like, isn't that just part of life
Isn't that
after having a
normal?
baby? Isn't that normal? And so they don't go and seek it out because they think it's normal. It's a taboo topic and they don't talk about it as much. And when they start talking to me and opening up and they realize, oh, I've actually been dealing with all of these things that I thought were normal. And, no women should have to live like that, I don't think.
Absolutely not. And as as your work, you work right through to like menopause.
That's right.
So I'm sure a lot of the issues that women are facing in menopause, I know that's a totally separate, it's a separate identity. It's a separate time of life. But I feel that some of the issues that you have as, as a menopausal woman is like as a result of what's happened before, and it's just, you just wish that you'd gotten, because it's quality of life, right? So it's so important. It's so important. And
a lot of the women, like, once I have women come in for a musculoskeletal consult rather than a women's health consult, and I start talking to them and I say, okay, well, is there anything else you want to touch on, any bladder or bowel function issues? And then they just start, telling me everything. But they've come in for something totally irrelevant, not relevant to the women's health space anyway. So we just sort of fall on it as a coincidence, I guess.
Yeah, because it's a personal thing. And I suppose a lot of people don't want to discuss these things because they're not so pleasant.
Yes.
So just tell us about what are the main, when you speak to these women and they come in for their physio appointment, and then obviously come and tell you the real truth. Yep. What are the areas of concern? What are the main things that are going on? And is it during pregnancy, or do you see women during pregnancy as well?
Yeah, so I'll start with pregnancy, and a lot of the times that women come in for pregnancy is typically when they're in pain. And women often present with low back pain, most typically one-sided low back pain. And that pain can sometimes sort of run down their leg in a sciatica type referral. And that can start for women, in the first trimester and can get worse as the time goes on. Physio is a fantastic way to manage this pain with some soft tissue work, some release work, and some exercises to help maintain that throughout the pregnancy. So probably lower back pain in pregnancy is one of the biggest things I see. And then sort of moving through the lifespan for the, 40 to 55-year-old woman, I would say, I start talking about their knee pain that they come in for, or their rolled ankle, or their neck pain.
All of the above.
All of the above. And then I say, tell me about your bladder. And they say, sometimes I have to rush to the bathroom. Okay, and, is there any leakage? Oh, yeah, I wear pads every day, and that's not normal. It's not normal.
No,
and
it's not normal.
No, and it's this incontinence, this rushing. So you can have this urgency incontinence where it's like, oh my gosh, I got to go and I got to go now. Or you've got this stress incontinence, which is your sneezing, coughing, exercise. Oh, I just leaked a little bit. Better cross my legs before I sneeze. And
I know the one.
Yes. The quick cross of the leg. So you don't. Yep. So there's no leakage. So yes, probably that incontinence is huge, and that can also be bladder or bowel incontinence. And similar to you, Jen, if you've had those real 4th-degree tears, those tears can run right up around the anal sphincters and can have a large impact on your bowel function. And so obviously a lot more taboo than the urine incontinence. Bowel incontinence can be a huge issue as well. And it really does diminish quality of life because women stop themselves from going out, doing things, enjoying themselves because of the fear that they'll have some incontinence while they're out and about.
Not only that, it can lead into other things. I mean, when my son was 2, I was then diagnosed with diverticular disease, which I've suffered with my whole life now. Ended up multiple operations, multiple surgeries, and a bowel. I've had some of my bowel taken out, and it just leads on to other things. Whether that was the reason or not, how will I ever know? But obviously, there's a very, very big chance that it was all interconnected. And
this domino effect.
Yeah, absolutely. So it's way more important, and I think it should be spoken about a lot more than it is.
That's right.
Um, and and I think people need to know about people like yourself, and know that there are people just like at the physiotherapist, that a lot of physiotherapists now will have that service, don't they? Or is it common for
Um,
physios to run this service for women's health?
There's sort of varying levels of service available at the moment.
Mm.
Most physios have a general understanding of women's health, and I guess it's how far deep you want to go into that area as a patient. So women's health screening can be as little as a assessment of your core stability, or it can be internal examinations, internal massage. It can get really quite personal as well. If you're having more complex issues, you need to see someone who has very good women's health experience and training, because it's a whole other world, women's health. If you're sort of struggling with a mix of musculoskeletal and women's health, you probably don't need to go as deep down that path, but do your research, see what the physio provides, and typically if they have a women's health specialty, that will be advertised somewhere as well.
Okay, that's really good to know. And when people do come to you,
Yep.
Obviously you talk to them about the things that they can do. So whether they're pregnant, or whether after they've had their baby. So I guess when you see a woman that's pregnant, and you might see them for their lower back pain, but do you talk to them about other areas of women's health and things that they can do whilst they're pregnant? And what are some of the things that you can do whilst you're pregnant to prevent some of these things perhaps from happening?
Yeah, absolutely. So they present with the lower back pain, which is great because it provides an opportunity for me to open up the conversation about taking care of yourself throughout the pregnancy and what life looks like postnatally as well. And a big topic of the conversation is exercise. And there is a lot of fear about exercise in pregnancy, and there doesn't need to be that fear either. Whatever exercise you were doing before you were pregnant, that is safe for you to continue into pregnancy as well. So if you're a runner and you feel safe running, and you're running multiple times a week, you can continue running throughout your pregnancy. Unless if by medical advice you get told by your OB or something like that you shouldn't be doing that, totally different story. But if you're a low pregnancy and you have the capacity for this type of exercise before you're pregnant, you can continue that well into your pregnancy.
Good to know.
I think that's a big one, right? Because a lot of women, oh my gosh, I'm pregnant, I need to take care of this, precious bundle, I'm going to stop everything.
I have to sit on the couch and eat what I want.
That's right. But that's typically what causes these pains, these lower back pains, because your body's like, hold on, I'm used to moving all the time. Why have we stopped moving? Because that movement is medicine in all aspects of life. So exercise is definitely a big topic, and I get a lot of women in here that come in for their low back pain, and then we commence some pre-postnatal Pilates, and they can do that Pilates throughout their entire pregnancy up until a point where they feel like they can't do it anymore, which is fair enough.
Yeah. Which is great for your core, right?
Yes,
which great. Then is great.
Core. That's right. Pulls everything together, keeps you nice and stable. We have some conversations about pelvic floor contractions and pelvic floor work throughout the pregnancy as well, and the importance of keeping that as strong as possible throughout the pregnancy. Some women's health, not me personally, but some women's health physios offer some birth prep physio as well, which actually involves some perineal massage to actually prepare you for labour and delivery. That is something that you would commence sort of at the 36-week mark, and that's a good time to check in with the women's health physio if you're feeling like you need some prep as well. And then some postures as well. So sitting up out of bed, sitting up off a couch. There's some advice on avoiding sit-ups from that sort of 12-week period onward to avoid any of that abdominal separation that we can see sometimes as well. So lots of topics of conversations that we sort of covered during that pregnancy period, as you can see. Yeah.
And I guess it's for, it's tailored to you then, whatever the plan is.
That's right. Everyone is
pre and postnatal.
Yep. Everyone has a different journey coming into the pregnancy. Everyone's journey is unique, and everyone's symptoms are really unique as well. So I take it on a case-by-case basis, and it's very individualized. And all of our Pilates that we do here at Function PCP are very individualized as well. So I think it's a really great, safe space to be on that pregnancy journey.
Absolutely. And are there things that we should be doing before we even fall pregnant, do you think?
Well, movement is medicine, right? So I'm a big advocator for exercise, and exercise looks different for everyone. The exercise that it's just movement, you know?
Yeah.
You might love going to the gym. You might hate the gym and love doing Pilates. You might love yoga. You might love swimming, because it's important that whatever you are doing before you're pregnant, you are so safe to do whilst you're pregnant. I think doing nothing and then getting pregnant and then wanting to start something, it's a little bit of a different journey, because your body's already under this stress carrying this baby, and then suddenly you're throwing all of this new exercise at it as well.
Yeah, exactly.
So pelvic floor contractions before you get pregnant, keeping that pelvic floor in check, keeping that core in check.
Is that like at the traffic lights when you're in the car? I remember that from way back when.
Yeah. But then again, everyone's pelvic floor is different. For some people, they have a weak pelvic floor and it needs training. For some people, they have a good level pelvic floor. For some people, they have an overactive pelvic floor, and that causes a whole bunch of issues with pelvic pain with tampons, pain with penetration. And so everyone, again, you can see sits on a different level of where their pelvic floor training needs to be. And if you're unsure of where you're at, and if you suffer with pain, particularly with tampons or with penetration, a women's health physio is a really good place to start,
right? And that's it. People, I think after having a baby, you don't know what to expect, particularly your first baby. You've got no idea what to expect. And I think we're so focused on, during the pregnancy, just focused on that day of giving birth. And that's all we think about, is just getting to there and having the baby. And then you have the baby and you don't think of these things. And so after you've had the baby, you tend to just go, well, this is normal. This is how it's supposed to feel. It's everything's different now. And I don't think that there's enough information. And after you have a baby, things should go back to normal. I mean, unless, you know, you've had complications with birth, really, things should go back to normal within a particular time frame, right?
That's right. And it's certainly a journey, and everyone's different. Everyone's journey is so different, but your journey is going to be so much easier the more that you take care of yourself throughout the pregnancy as well.
Exactly. It's self-care. And we all talk about self-care being going to the day spa or going to have lunch with your girlfriends or going to the movies and all those things, and taking time out from caring for your child or your baby. But, you know, so real self-care is knowing and being mindful that if I don't feel right and I don't feel like this is right, then it's okay for me to go and investigate and to find the help that I need to make it better, because it shouldn't be that hard.
That's right. And I think what's important as well is some women have their first baby and then they say, oh, well, I'm going to have another baby or another 2 or 3 babies. So why
worry?
Why worry now? I'll worry about this later. But let's deal with this now. Let's get as strong as possible now, because you're going to be so much better for it in your second pregnancy, and then postnatally, and then your third pregnancy and postnatally. If you leave it for that whole time, you're starting from scratch in 7, 9 years' time.
Yeah. And it's even doing it whilst you're going through the journey.
That's right.
Consistency is key in all areas of life.
That's right.
That's our big motto. WOTBaby's big motto is consistency is key when it comes to sleep and routine, but it's also very true for ourselves and for our self-care, our self-worth, and our health.
Yeah, absolutely. And then another thing that I speak with some women about is returning to having sex with their partner postnatally and what that looks like. And there's a lot of things to take into consideration here, because if you're breastfeeding, it lowers your estrogen. And so it makes it a little bit drier. And so you maybe need a little bit of assistance returning back into that journey with your partner as well. And that is something that a women's health physio can help with.
Yeah, so you might not know that, and you might think, why, you know?
That's right.
And And
That's
then
right.
it can create bigger problems, I guess, from
Exactly.
that with your relationship.
Yeah.
Yeah,
So
it's really good.
so many things we can help with, so many things. All you need
Yeah,
to do is ask and find your right support system, really.
that's really fantastic. Really
Yeah.
good. Well,
Yeah.
it's been really lovely talking with you, Zoe. And I
Yeah.
hope that anybody that's out there that's even, to just go in and talk with,
Yep.
as I said, you're from, and I'll put the link in and all of the information so that
Yep.
people have it. So if they
Yep.
do want to come and see you,
Yep.
but to find that physiotherapist where you can speak to somebody about women's health, just to ask the question, because if you
That's
don't
right.
ask the question,
Mm,
then you're never going to know.
never gonna
And
know.
yeah, and if you're, you want to be the best mum that you can be, and you can love your baby with all your heart and do all of the right things, but if you're not 100%, then you cannot possibly keep giving it 100%. So it's super important that self-care comes first.
That's right. That's right. And there's from a
Absolutely.
women's health physio, you'll never have any judgment. It's always an
No.
open space. It's a
Yeah.
safe space, so you can
Yeah.
share whatever stories you need.
Yeah. Well, that's fantastic. Thank you so much, Zoe, for your time.
Thanks, Jen. Thanks for having
I
me.
really appreciate it, and I'm sure that lots of mums will as well.
Yeah. All right.
So
Thank you.
thank you. See you later. Bye.